Assalamu alaikum. It's an honor to be here, and thank you very much, Sheikh Abdulaziz, for the opportunity to talk to you about what obviously you must have heard is a passion to me, hyperbaric oxygen therapy. And as we reminisce this evening on things of the past, we have the opportunity to also consider the things of the future. And it is with that that I'd like to talk about a fascinating modality that is increasing in its application as we move towards the future. Now, hyperbaric oxygen therapy may be an old modality, and its application starts very simply in breathing oxygen under pressure. Importantly, though, the oxygen has to be delivered to the tissues via the circulation. You can't just put it on a wound. It needs to be delivered by the circulation to have a therapeutic effect. So essentially, we increase the pressure under which you breathe the oxygen. More oxygen is transmitted through the lung and enters the arterial system. And that is the essence of what hyperbaric oxygen needs to achieve. Now, there are two styles to do this. We have a bus, if you like, and a single modality or vehicle. The bus can treat more than one patient at a time. They follow the same protocol, and they breathe oxygen through a head tent or mask in an air-filled chamber. The monoplace is single patient, and the chamber is pressurized with oxygen, and they provide air for air breaks, which I'll explain in a moment, as part of the therapy, and they are equivocal. One benefit, though, the monoplace can be titrated to an individual's needs. Now, the air that we're breathing here is 21% oxygen, and it's 21% of an atmosphere, which is 760 millimeters mercury. So, in effect, you're breathing 159 millimeters mercury of oxygen as you're sitting here. Under those conditions, the oxygen cascades essentially down into the cells and the powerhouse of the cell, which is the mitochondrion, where we get oxygen and hydrogen, which is what you get through the food that you eat, combining, which is essentially rocket fuel that produces ATP, which is the cell energy. Now, this gradient is what drives the process, the contrast between what you're breathing and what is needed in the cell. Now, under hyperbaric conditions, we move from 159 millimeters mercury to 1,550. It's literally 10 times. And so you can imagine there's an enormous gradient now that is able to drive the oxygen into the tissues, reaching further and also inducing not only physiological effects, normal effects, but pharmacological effects, medicinal effects. Now, if you consider oxygen as a drug or a medicine, this is the pill. This is the standard oxygen therapy session that we would provide for most indications. So as you can see, you start at 1 atmosphere, and then the pressure is increased over 5 to 8 minutes, and then you breathe the oxygen essentially for 20 minutes on, and then 5 minutes on air, and you repeat that 4 times for reasons I'll explain shortly, and the total period is 2 hours. Now, for those of you that gave these chambers one look and thought, you won't catch me alive in one of those, I want to get to this slide, which I like to get to very quickly with our patients. The treatment, unlike most things in medicine, is pain-free. If there's pain, there's a problem, and it's usually related to ear pressure and adjusting to the pressure. And we make sure that patients can do that. They don't feel weird. You don't feel weird in the chamber. It's just oxygen. You're never alone. You're never trapped. We can speak to you and hear you all the time. And in fact, as some of the people here will attest, the most difficult decision is often what movie to watch to allow the 2 hours to dissipate. I'm also very grateful to have my wife here, Sister Lucy Cronje, who's been doing this with me for 30 years. And this is essentially what happens every day, and the patient's receiving the hyperbaric oxygen, and it is actually a very calm environment. And many patients are grateful to be away from their cell phones for a while. Now I want to turn back to history. Hyperbaric oxygen therapy started as a treatment for decompression sickness, what scuba divers or deep sea divers get when nitrogen comes out of solution as bubbles and causes disruption in tissue. On the clinical side, there were two streams. The first was using hyperbaric oxygen to make tissues more sensitive to radiotherapy. And Churchill-Davidson pioneered that, and it was all over the world for many years. In fact, the reason why the monoplace chamber is transparent is because they had the cobalt heads outside and they needed to provide the radiotherapy wherever that was required. On the other hand, there was an intrepid cardiothoracic surgeon called Ait Buruma, and he was pretty good with cardiothoracic surgery. He could do a tetralogy of Fallot in 4 minutes. But at that stage, without cardiac bypass machines, there was a limit to what could be done after there was cardioparesis. So, enter hyperbaric oxygen. And to prove the point, what he did is he took pigs, bled them out, had them in the hyperbaric chamber at the equivalent of 20 meters below the sea, and he was able to record normal ECGs. Which is to say that when you are at pressure in a hyperbaric chamber, you have enough oxygen without blood. Everything is delivered through the plasma. Now, just to close the story with Ait Buruma, he, in true Dutch thriftiness, re-ensanguinated the pigs and sold them back to the farmer. But he also introduced a tremendous epoch in hyperbaric medicine. One of his colleagues, Brummelkamp, developed the use of hyperbaric oxygen for gas gangrene. And to this day, for reasons that aren't entirely clear, the Dutch have the greatest series of gas gangrene in the world, including in wartime. We think it might be because they have cows by the side of the road, so each motor vehicle accident is set up for gas gangrene. But they have tremendous experience, and this is where hyperbaric oxygen therapy has come from: diving, radiation, and infections. Fast forward to 1977, and now we have a number of indications that pretty much are the bedrock of how we use hyperbaric oxygen. When bubbles enter the circulation or in tissues as a result of diving or medical procedures, we can compress those bubbles. If decompression sickness happens, we can treat that. And carbon monoxide, which poisons cells, well, the oxygen is a primary antidote for that. So in these conditions, hyperbaric oxygen is the therapy. But for everything else, it's adjunctive. In other words, it supports another modality, mostly surgery. So in life-threatening situations, I mentioned gas gangrene, that still continues to this day, and although far more, I should say less frequent nowadays, I myself, over the past 30 years in South Africa, have treated 5 patients with it, which were quite anomalous and mostly associated with intestinal cancers that developed spontaneous gas gangrene. Necrotizing soft tissue infections where the skin literally melts away is one of the complications we see with diabetes. Severe anemia where you can't provide a transfusion for religious or medical reasons, hyperbaric oxygen can buy you time. And if there's a crash injury where there's destruction of tissue, hyperbaric oxygen can keep the tissue alive and minimize the damage. Thermal burns. How many of you have treated thermal burns? Well, most of you that have will recognize that within the first 48 hours, people balloon, or the limbs that are burnt balloon. And hyperbaric oxygen attenuates that. If we had more time, I'd show you some of our slides, but if you start within 24 hours, you can often mitigate a partial thickness wound that it doesn't extend and doesn't even need grafting. It's quite profound. Intracranial abscesses that can't be operated, HBO improves survival, not only partial recovery. Sudden hearing loss and blindness are also indications. And then on the chronic side, bone infections that don't respond, radiotherapy that has allowed a patient to survive the cancer, but now they have if you will, the luxury to develop complications from the radiotherapy. A tooth is pulled and the jaw falls apart. Reconstruction is attempted and the flap fails. And in that setting, hyperbaric oxygen therapy can prepare for surgery and guarantee that it's successful. And then diabetic foot infections, which is probably in this area of the world one of our main indications that we see. And lastly, avascular necrosis of the femur, where the blood supply to the head of the femur is compromised. And in this part of the world, once again, with sickle cell, this is a very common problem, and it can avert death of the head of the femur and multiple hip replacements. So, what we've learned from all of these indications is essentially that hyperbaric oxygen therapy does 5 categories of things. It provides more oxygen, that's obvious. It actually narrows blood vessels partially, which works almost like ice would for sports injury, in that it resolves the swelling. It stimulates the body to form new blood vessels growing into tissue over a period of time. And there are a number of cell effects, and these are the areas where the new frontier has arisen. Because it modulates the immune system, it stimulates fibroblasts to release collagen and have it cross-link more effectively, so it's tougher. You have neurons who, after injury, do not resume normal metabolism and activity, that are literally latent and are, if you will, woken up through hyperbaric oxygen therapy. Hyperbaric oxygen therapy releases stem cells. After 20 treatments, people have 8 times the number of stem cells circulating. So it's essentially stem cell therapy. And mitochondria. When I started medical school, the chapter on mitochondria was probably about a page and a half. Nowadays, there are very thick textbooks and pretty much the same number of articles that appear, because the mitochondria is either the breath of life or the kiss of death. And I'd like to stop a little bit on the mitochondria in a moment and explain why a grandmother has the mitochondria of a granddaughter, but the time that the person survives only starts to click when they're born. Those mitochondria go back generations, but it's only once a person's born that the time starts ticking. And this is part of the mystery of mitochondria in life, and it's also part of the keys to longevity. And lastly, we spoke about bubbles, and pressure and gas gradients are things that we deal with diving and arterial gas embolism. Now, to show you how recent these new developments are, the Nobel Prize in 2019 went to these 3 scientists that were able to describe how oxygen stimulates and essentially works as a signaling molecule in cells. We've always known something happens, but they were able to elaborate how it affects genes and, very importantly, the release and development of hypoxic inducible factor. And I'll talk about that a little bit more. Why this is important is because this is what we are doing with this profile. You may have wondered, why on earth do we give air breaks after every 20 minutes? Well, we used to do that because we thought oxygen might be toxic. But now we realize what actually happens is we have a yo-yo between high oxygen and normal oxygen, and the body resets to the higher value. And so it develops antioxidant defenses, for one, and secondly, it actually produces new mitochondria. So there is a division, and there is a greater concentration of mitochondria in cells now to be available for the greater amount of available oxygen. And that is key to many of the conditions that I'll cover next, which is where the future of hyperbaric oxygen therapy is going. And I'm going to specifically refer to the following 6. Inflammatory bowel disease. So we're talking about Crohn's disease and ulcerative colitis. long COVID. People who after 3 months, whether or not they had symptoms of COVID, have mental fogging, have cardiac problems, respiratory problems, neurological problems such as continual loss of smell, and there is no therapy for that nowadays. We can attenuate some of the circulatory problems with other medicines, but nothing reverses it except hyperbaric oxygen therapy. We'll also talk just briefly on traumatic brain injuries, interestingly and intriguingly post-traumatic stress disorder, fibromyalgia, and of course aging and neurocognitive degeneration. So just to show you the burden of disease, inflammatory bowel disease will by 2030 affect 1 in 100 people. Traumatic brain injury, 10% of those who have a traumatic brain injury have long-lasting effects. The cells just never come back to normal metabolism. Long COVID, 20% on average of people who either had symptomatic or asymptomatic COVID develop long COVID. It's extremely prevalent and a silent epidemic. PTSD about 4% in our war-torn world, fibromyalgia also about 5%, and neurocognitive degeneration. As our populations age, it is becoming an increasing problem. So just to show you where the evidence lies in these indications, this is the familiar Oxford classification of evidence-based medicine. All of the indications I'm mentioning now fall within the top tiers, the first 4 top tiers. So we're not talking about experimental information, we're talking about established clinical information that is yet in the process of being refined. Perhaps the most important slide is this, and I'll go through it clockwise. Hyperbaric oxygen therapy, as I indicated, releases stem cells. Not only that, it forms part of how cells are ultimately destined for the tissues that they are to support. As we're sitting here, we're losing and producing and renewing our tissues and organs. In order to do so, we need 3 things. We need cell structures that have integrity and all the necessary parts. We have DNA that needs to be able to replicate in order to continue, and we need mitochondria in order to have energy for the cells. So I've already said that HBO releases the stem cells. But the next interesting thing is that as we're sitting here, our chromosomes have some extraneous material. At the tips of your chromosomes, you've got some extra DNA. The reason for having this, and they're called telomeres, can most easily be explained by thinking about a photocopier. Look at a photocopier, Xerox. If you make a copy, the copying mechanism needs to go beyond the window in order to make a complete copy, right? So what the telomeres do is they allow that copying mechanism to go beyond the window, if you like, and make a complete copy. Once you've lost your telomeres, cells can no longer divide. That's it, tickets, halas, they're gone, all right? Now what happens with hyperbaric oxygen, it stimulates the DNA to actually extend, preserve but even extend telomeres, and therein lies one of the keys to why it causes or may support longevity. And then I mentioned the mitochondria. Fascinatingly enough, we would think bombarding them with oxygen might poison them. The opposite, in fact, happens. It equips them, energizes them, and causes them to replicate so that cells can actually process more energy. If I had to summarize it in one sentence, hyperbaric oxygen therapy essentially does what exercise does for you. Now, I'm not saying you should substitute the one for the other. Exercise is a good thing, but in many ways it replicates some of those mechanisms. A big aspect of all the problems I mentioned is inflammation, and then we need blood vessels in tissues in order to bring the circulation there. So that's the one slide. The next is this. This explains our paradox. How it could be that by providing copious amounts of oxygen, we ultimately prime the body to defend itself against oxygen radicals and thereby provide adequate and in fact even additional protection against aging. That's the key. Oxygen can, on the one hand, shorten life. But if you boost it temporarily, the body resets and develops defense mechanisms that actually allows it to combat aging. I'll briefly touch on the key events or the effects related to the 6 conditions I mentioned. I'll start with inflammatory bowel disease, and as you can see, these conditions, those of you who are surgeons, are very, very familiar with the hypoxic aspects, the necrotic mucosa, the inflammation, which is a major part, the lack of blood vessels, the need for tissue renewal, normal tissue renewal, mitochondrial function, yet again, and modulation of the microbes in our gut. Increasingly, we know that what is in our gut is not only the food that we eat, but the microbes that process that food and maintain a climate in conjunction with our immune system. Our gut is our greatest immune organ, and it is sadly, of course, ravaged by antibiotics, chlorine in the water, etc. And one of the problems with inflammatory bowel disease is the dysbiosis of that microbiome. And hyperbaric oxygen is able to restore that, which is a major, major piece of its contribution. And so far, the studies that have come out show that 8 out of 10 patients go into remission. That's pretty impressive. Then the next is long COVID. And here, I would summarize to say that looking at the neurological sequelae and the myocardial sequelae, we now have randomized, double-blind, sham-controlled evidence showing that it reverses the effects of long COVID to the pre-morbid state. In other words, a person's mental function goes back to what it was before COVID, and the same with heart muscle. And there is nothing else that does this. And the evidence is not only properly gained, if you like, but it is supported by actual images and understanding of the mechanics. Some of the best research has been done. So we're very excited about this indication, and we've had the privilege of treating a number of patients. And the most remarkable thing that we hear is, I never realized how much of a problem I had. I didn't realize how foggy my thinking had become, that I was depressed, but it was due to long COVID. Or that I was perpetually tired. Whenever I exercised, it felt like I had flu afterwards. Common symptoms attributed to long COVID. Concussion and traumatic brain injury, again, the same familiar mechanisms there. We need oxygen, we need to attenuate the inflammation, we need to support neuroplasticity. And fascinatingly, the memory part of our brain, the hippocampus, is the one part of the brain that we know can regenerate. We always used to think once you've hurt your brain, that's it. But the hippocampus, the memory, which is so precious, and one of the things that we are so much in fear of losing, is the one part of the brain that can regenerate. And hyperbaric oxygen stimulates just that. Of course, if it's a fresh injury, it can help prevent that it gets worse, and importantly, it improves and restores cognitive function and memory. Now, here's a strange one. Why on earth would hyperbaric oxygen therapy work for post-traumatic stress disorder? It seems inconceivable. But if you think about it, only 2% of your body weight is brain. 2%. But your brain uses 20% of the oxygen that you breathe. And even then, the brain needs to shunt this way or that in order to regulate, and it's called coupling, regulate the flow of blood and oxygen to the parts of the brain that need it. Now, if someone is suffering from post-traumatic stress, part of their brain is hyperactive to the extent that it uses all the oxygen and there is none left for language to express how they feel, to process what has happened to them. Once they're in the hyperbaric chamber, the brain has more than enough oxygen, and suddenly the brain starts talking to itself. And we are now doing research for the first time actually at King Ahmad, where we're looking at neurofeedback, where we're literally stimulating the brain to develop those connections. It can do it spontaneously. We believe we'll be able to facilitate that even further. So finally, just like the individuals themselves who feel isolated due to PTSD, their own brains get back into community with itself. It's fascinating to see and very, very rewarding. Fibromyalgia, those of you who know people that suffer from this know how debilitating that can be. Many of the problems relate to either pain or inflammation and sleep problems, and HBO attenuates all of those. And lastly, neurodegeneration and aging. I've covered the consequences of aging with inflammation, oxygen problems, and a lack of antioxidant defenses, which HBO restores. So in conclusion, and those are the favorite words to every speech, right? So in conclusion, HBO has modern relevance. It is effective in doing what I've said, improving cell energy, reducing inflammation, restoring brain function, attenuating the consequences of long COVID, and assisting in establishing longevity in combination with other modalities. It has to be used under medical supervision. There are potential side effects and complications, and most importantly, patients need to be appropriately selected. That's the key. Selection determines outcome. So with that, I'll just tell you that I will be sharing this PowerPoint series with anybody who's interested, and I have the references that I've listed on the slides that you saw for each of the conditions, and I encourage you to have a look and see how hyperbaric oxygen therapy may have been an old vehicle, but it is really paving the way to our understanding of future wellness and resilience. Thank you.